Hello, I'm Marcus Boston. Quick video today, and we're going to discuss some of the signs that may be present from a medical legal standpoint, which might be able to let the parents know that their baby may not have been tolerating a vaginal delivery well. So the purpose of this video, and the reason why I'm talking to you about this, is because what we have is when parents contact us, and this is generally mothers, and their baby has suffered a brain injury at birth, they're replaying what happened during their pregnancy and during the labor and delivery, and they're thinking about everything that was going on. And for some mothers, it's really hard because they tend to blame themselves for what happened. And so when we talk with families and we're doing an investigation, we're doing our best to do that investigation and to figure out what was the cause of this baby's injury at birth, what caused that brain injury. And so for today, I would like to talk with you about some things that can occur during labor and delivery that might suggest that a baby is no longer tolerating that vaginal delivery well, or that there may have been some problems along the way. And one of the ones that we see a lot, or we see, sometimes, is that when the nurses or the doctors, they're moving mom around a lot. And this is not just, this is moving mom on the left side, moving mom on the right side, moving mom back to the left, moving mom to the right. If you'll see a lot of movement of mom, putting mom in a lot of positions during labor and delivery. Another issue could be is that when the baby is born, the baby is discolored. The baby may be, blue or purplish color. There may be situations in which the baby is not breathing on their own. The baby's not breathing and the baby has to be resuscitated. The NICU team is present. If the NICU team is present and the baby has to be passed off to the NICU team, those can be, that could be cause for concern as to what's going on with the baby. In addition to all of these things, initially when mom's water breaks and there's a substance called meconium that is in the fluid, and I've talked about meconium in other videos, but quickly for this video, meconium is the baby stool. And so when you couple the meconium with maybe problems on the electronic fetal heart monitor, which is showing that the baby may be in distress, and even though conservative measures or conservative treatments, what I talked about earlier, moving mom around, giving oxygen, a bolus, certain things like that, if these things are not clearing up the fetal distress or the problems that the baby's having during labor and delivery, then doctors and nurses have to be ready to move to another, they have to move in another direction, and that can be an emergency C-section when warranted. So the purpose of this video today is to kind of help you understand some of the things that we're looking at when we're doing these investigations and we're trying to figure out what was going on during labor and delivery, what caused the baby to have a brain injury, especially when other things are not present. So for example, there's no evidence of an infection or chorioamnionitis or anything like that, and there's no genetic or developmental issues that are present, but the baby has a brain injury at birth. So these are all of the things that we're looking for, or we're looking at when we're doing these investigations for parents. If you have more questions and you would like to speak with me about your baby's brain injury at birth, this is what I invite you to do. Go ahead and pick up the phone and call me. There's a telephone number down below. I talk with families all the time about these issues. One more thing that I want to share with you. I practice law here in the state of Maryland. And if you are not in Maryland and you call me, because this video is on the internet, if you call me and you're not in Maryland, you got to understand that we have to use co-counsel. In other words, local counsel. That's an attorney in your state, and we will help with that. But we have to use an attorney in your state to help move the case forward. So I just want to make sure that you understand that local counsel aspect of things. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. We will see you next time. Take care and enjoy the rest of your day.